I'm Carrie from Peak Performance. Today I'm going to show you our exercise protocol for capsular release surgery. What is capsular release surgery? Occasionally people end up with what we call a frozen shoulder or adhesive capsulitis. Essentially the shoulder doesn't move very well because it has gotten too tight, and it doesn't resolve with conservative treatment like physical therapy. So then surgery is warranted. The physician under anesthesia, obviously the patient's under anesthesia, not the surgeon, has selective cuts into the capsule of the shoulder that then allows the shoulder to move fully again. The patient recovers from the anesthesia, and then shortly after that is brought over to physical therapy, and we as physical therapists, the first day, show the caregiver how to perform stretching exercises on the patient 8 times per day. On the second day, the physical therapist shows the patient how to perform the exercises on themselves. Again, performed 8 times a day until the therapist says otherwise. And it is important to do it 8 times a day because the body is trying very hard to put you back to that stiff position, and we're trying to fight that tendency by keeping it mobile and stretched out. Hi, I'm going to show you 5 different exercises that are used the day of shoulder surgery for adhesive capsulitis, which we were saying is called a capsular release. Denise is going to pretend to be our patient here, and keep in mind she has just come out of surgery, is a little bit out of it, and so what I would do is show the caregiver how to do these exercises. So imagine that I'm the caregiver doing these exercises. Denise's involved shoulder is going to be the left one. The first exercise is shoulder flexion. So I'm going to grab her arm, and quite likely after surgery she has had a nerve block and has no feeling in this arm. So we can use that to our advantage and get as much motion as we possibly can. I bring her arm up over her head, keeping her arm rather close to her ear, and our goal, normally after surgery I might feel a little tiny bit tight right here, and I'm just going to hold it for a few seconds, then back off, give her a little bit of break, even though she probably wouldn't be able to feel it, and just work our way down until her arm is near her ear, and this upper portion is actually flat on, in our case, this table, at home preferably the floor, because it's a little less forgiving than the bed. Once you've actually reached the goal, then you're done with that exercise. It could take anywhere from 2 minutes to 5 or 10 minutes. The second exercise we call the snow angel. I'm going to be taking Denise's arm, again supporting it, and I'm just moving it up parallel to the floor or the table, as if you're making a snow angel type movement. And our goal is to gradually work it up until I feel a little resistance. Let's pretend we feel some here. I'd hold it for a few seconds, then back off a little, and just keep inching my way up until we end up with her arm actually touching her ear like that. And then I usually hold it in this end range position for maybe 30 seconds to a minute, just to make sure we really have it stretched well and that it easily gets up there. And again, you want to make sure you're done with the exercise once you meet the goal, which is the arm touching the ear. This third exercise is for shoulder external rotation. What I'm going to do is use my left hand to hold Denise's lower arm kind of by her elbow and keep it tight to her side. And then with my other hand, I'm rotating her arm out towards the table or floor. Normal here is 60 degrees, so if this is 0 and flat we're 90, she's 2/3 of the way, roughly. And so what you do is, as I'm rotating it out, if I feel a little resistance here, I'd hold it for a little while, 10 seconds, 30 seconds, whatever seems like a decent stretch. Let up, give the person a break a little bit, and then continue to work. And again, you're done with the exercise when you've actually met the goal. The fourth exercise is also for shoulder external rotation, but this time it's going to be done with the arm at 90 degrees. So I've slid Denise's arm out, so we have a 90-degree angle here at the shoulder. Still have a 90-degree angle at the elbow. I'm going to just support Denise's elbow with my left hand and rotate back. The goal here is 90 degrees, and 90 is going to be flat on the table or even just a hair below the table. If I meet some resistance, I just hold it for 10 seconds to 30 seconds, back off, and continue to work my way down, again until I've gotten the goal of 90 degrees, then you're finished with the exercise. This last exercise is for shoulder internal rotation. What I'm going to do is bring Denise's shoulder back up to 90 degrees. The tendency if I were to rotate her shoulder down is that her shoulder would pop up, which is kind of cheating. So what I do is I position myself, again holding her elbow so that it doesn't slide down. With my right elbow, I'm going to hold her shoulder in place. This arm is also making sure that as I stretch, her shoulder doesn't migrate down this way. So I'm holding it up, and then I use my right hand here to push down until you feel a little resistance, and again hold the stretch for a little while, and back off, and hold it longer than that, but anywhere from 10 seconds to 30 seconds, depending upon, if it doesn't hurt, hold 30, if it hurts, hold only 10 seconds or so. The goal here is again 60 degrees, so 2/3 of the way, where this is 0, flat would be 90 and not normal. 2/3 of the way is about that. And when you reach that goal, you're finished with the exercise.